I would like to add some few points in basic understanding for ILD. One is IPF versus non-IPF. So regarding the disease classification, one, we know that etiology is known, where we know this DISCO, and in the another limb here we can see etiology unknown, and one is idiopathic interstitial pneumonia, and there is a divided into IPF and non-IPF. So how this division happening actually? So this was classified idiopathic interstitial pneumonia based on IPF and non-IPF. This was based on CT findings. All right. So IPF CT findings are radiographic characteristic, a typical UIP pattern are classified in IPF, and those who do not have a typical UIP pattern in CT or radiological features characteristics, that is in the non-IPF. And there are 4 types of ILDs included in non-IPF: NSIP, COP, cryptogenic organizing pneumonia, lymphocytic interstitial pneumonia, and acute interstitial pneumonia. One thing here I want to make it clear that ILD is a clinical diagnosis. Okay, we diagnose patient clinically as ILD, and when you do a CT or radiological findings, we see typical UIP pattern. All right, and this typical UIP pattern is seen in IPF. So when initially the ILD was studied and the disease was, when initially it was come to play, so ILD was taken as a synonym of IPF. All right, so to initial description was ILD means IPF. So it is simply a same thing, just like movie Amar, Akbar, Anthony, 3 brothers, different but they all originated from the same. So actually this disease is same, but the names are different. ILD is a clinical diagnosis, UIP is a radiological finding of the same disease, and when we cut that lung and we see under microscope, we find a typical IPF, idiopathic pulmonary fibrosis. We see the area of fibrotic bands all around the alveoli during a lung specimen histopathological examination. All right. So IPF is a pathological diagnosis, UIP is a radiological diagnosis, and ILD is a clinical diagnosis of the same disease initially. But now we know that ILD have a various diseases under this umbrella. All right. So this idiopathic interstitial pneumonias are IPF versus non-IPF. It is purely divided on the CT features. So if the CT feature is having definite UIP pattern like peripheral, subpleural distribution, bibasilar prominence, and reticular markings, traction bronchiectasis, honeycombing, and absent inconsistent findings. So if these features are present, then that ILD is called IPF. If these features are absent, they are called non-IPF. This classification is now further subdivided and updated also, but the basic concept remains the same. All right. So IPF is an end spectrum ILD where there is a pulmonary fibrosis, and we called it as an end stage lung disease. So this term should be very clear, like ILD is UI, what is UIP and what is IPF. So if there is a UIP pattern in the CT, if we do histopathological examination of that lung, then we can get a typical IPF finding on histopathological examination. Okay. So any CT findings which have this kind of features will be labeled as idiopathic pulmonary fibrosis. But if this type of features for different UIP are not there in the CT, that will be grouped under non-IPF. And non-IPF diseases are further characterized by NSIP, COP, LIP, and AIP. These all 4 diseases have a different radiographical or CT characteristics findings that we see on CT scan. All right. Next is why to diagnose earlier. We should remember that lung function FEV1, FVC, FVR, this all decline with ages individual without known lung disease. As the individual declines with the age, the FEV1, FVC, PFR, these all values decline. All right, but there is accelerated decline in the lung function in the ILD and COPD. So, and FEV1 is a very important marker. We can say this is it's a very important parameter for assessing the lung health. All right. So accelerated decline in lung function is seen in ILD and COPD. So we have to diagnose the ILD very, very early to save the lung, to improve the lung function and proper management of interstitial lung disease. Fine. So hope this makes the little bit understanding of basic ILD clear. So if you have any doubt, any query you want to ask, you put your description, you put your topic in the comment box, and we will try to make the simplified things in future. Thank you.